Here's what most people get wrong about high blood pressure, including a lot of doctors actually. It's not a one-cause problem. It never really was, but we treat it like one. You may hear, cut out the salt, or lose the weight, cut out sugar, or somebody may hear, do some cardio. And if nothing works, well then we blame genetics. And that makes it seem like there's nothing left to do. You're just stuck with high blood pressure. Well, I want to push back on that. So in this video, I want to walk you through the real but often missed causes of high blood pressure, even for seemingly healthy people. So we'll talk about things like micronutrient and vitamin deficiencies, and hormonal drivers, and metabolic factors. And the beautiful thing about this is these are all things that are measurable and actionable, meaning you can actually fix these pretty easily and you'll see your blood pressure come down fast once you know what you're looking for. The usual advice that people get is not wrong, it's just incomplete. And if you're new here, I'm Dr. Drkim. I'm a double board certified physician, and on this channel, I break down the most up-to-date and evidence-based information on the topics of weight loss, metabolic health, longevity, and as always, please talk to your doctor before making any changes to your health regimen, as this video is educational only and not medical advice. Now, as we go through each one of these hidden causes and different ways to fix them, I want you to think of this as a framework where you think of your blood pressure as a scale. On one side, there are signals that drive your blood pressure up. And on the other side, you have other signals that keep your blood pressure in check. And genetics can make some of those pro-high blood pressure signals stronger for you than for somebody else. And that's real. But genetics is not the whole scale. No single factor is a slam dunk on its own. But stack enough of them in the right direction and the math changes. So that's the overall goal here, to stack the good signals in your favor and fix your blood pressure for good. So let's start with something that most people have never heard of and most doctors actually don't check for routinely. And that's a condition called primary aldosteronism. And this is a condition far more common than the medical community has historically assumed. In fact, primary aldosteronism affects up to 20 to 30% of people with resistant high blood pressure. And if you have this condition, it needs to be recognized and treated as soon as possible, because primary aldosteronism puts you at a big risk. There's a 4-fold higher risk of strokes, and a 6-fold higher risk of heart attacks, and a 12-fold higher risk of atrial fibrillation, which is an irregular heartbeat that can predispose you to strokes and heart failure. And this is how it causes problems. This all has to do with aldosterone, which is a hormone made by the adrenal glands. Those two small glands that sit on top of your kidneys. So aldosterone's job, under normal circumstances, is to help you regulate sodium and potassium balance. When you're dehydrated or when your blood pressure is low, aldosterone goes up. And it tells your kidneys to hold on to sodium and hold on to water. And that's appropriate, and that's our system working correctly. But in primary aldosteronism, one or both of your adrenal glands start producing aldosterone on their own. Independently, without waiting for a signal. So the sodium retention keeps going unchecked and you retain more water, and that makes your blood pressure go up and stay up. Not because of what you ate, but because of what your adrenal glands are doing around the clock. Now, this has flown under the radar for a long time because for years, primary aldosteronism was considered to be very rare. It was only something the doctor looked for if we had a constellation of low potassium on the blood work and high blood pressure. So that was the red flag. And if there was no low potassium, then there was no reason to look. But the data has shifted. There was a landmark study that actually contradicted that historical assumption that you only needed to worry about it if you had low potassium. In fact, 50 to 80% of people who were eventually diagnosed with primary aldosteronism actually had normal potassium level at presentation. So there would have been a lot of undiagnosed cases that would explain high blood pressure in otherwise healthy people. So what does that mean in practical terms? Well, if you look at the 2025 Endocrine Society guidelines, they recommend screening for primary hyperaldosteronism in everyone who has high blood pressure. And if you wanted to get screened for that, the test you want to ask your doctor for is called the aldosterone to renin ratio. Now, if that screen comes back positive, well, then your doctor will need to do some additional tests to confirm it, and more importantly, to figure out what's causing this. In some cases, it's just a small adenoma or a small tumor that sits on top of your adrenal glands that's just making excess aldosterone, which in that case, sometimes people may need surgery to remove that. And in some folks, it could be both of your adrenal glands, they're just overactive, like with a condition called bilateral adrenal hyperplasia, which in that case, that's usually managed by certain medications that specifically block excess aldosterone. So this would be medications like spironolactone or aldactone. Now, unfortunately, there isn't a one-size-fits-all nutritional plan I can give you here. What you eat and what you limit can look very different depending on what's actually driving that excess aldosterone production and how it's being treated. So the diet piece, which is usually the foundation of how we approach things, really has to work alongside the medical plan that your doctor puts together. Now, another thing that rarely comes up in blood pressure conversations, even though it has a direct mechanism connecting to blood vessel damage and ultimately high blood pressure, and that is elevated homocysteine. And homocysteine is just an amino acid that forms as a normal byproduct when your body processes protein. And under normal circumstances, it doesn't hang around for too long. Your body converts it into other harmless compounds. But that conversion process requires B vitamins to work correctly, and specifically vitamin B12 and B6, which is pyridoxine, and B9, which is folate. And when those nutrients are low, and the most common of those would be low B12, well, that process slows down and homocysteine starts to build up in the bloodstream. And that creates a second layer of problems. And this is where the connection to blood pressure comes in. When homocysteine levels get too high, it becomes directly toxic to the endothelial lining, that thin layer of cells that lines the inside of your blood vessels. And this triggers inflammation and makes your arteries become stiff and inelastic, which all of that causes high blood pressure. And we see this pattern consistently in the research. Large population studies show a clear correlation between high homocysteine and hypertension or high blood pressure. And then Mendelian randomization studies go a step further and suggest that this is actually a causal relationship, not just an association. Now, the encouraging part about homocysteine is that in many people, this is very correctable, and the fix is usually pretty simple and inexpensive. In most cases, bringing B vitamin levels back to optimal ranges restores that normal metabolic pathway, and it brings homocysteine levels down. And this is especially true with folate. So there's a large meta-analysis of 65 trials that found that when folic acid was added to standard blood pressure medications, systolic blood pressure dropped by almost 8 millimeters of mercury, and diastolic blood pressure by almost 7 points compared to medications alone. And on top of that, there was about a 13% lower risk of cardiovascular events. So this would be things like heart attacks and strokes. And there was another study, and this is actually hot off the press. It was published just a few months ago. It was a small study, but a randomized control trial. This was done in patients on hemodialysis who had high blood pressure. And they found that supplementing with methylfolate and vitamin B12 significantly reduced both homocysteine and blood pressure over a 3-month period. But an important caveat here, it's not that folate or B12 directly lower blood pressure in everyone. The benefit only shows up when someone has both high blood pressure and elevated homocysteine. Fix the underlying pathway and blood pressure improves. One other side note, some people carry a variation in their MTHFR gene, and that can make it more difficult for your body to process B vitamins properly, which in turn can lead to higher homocysteine levels. And that's another factor worth checking if you have persistent elevations. Now let's talk about 3 things that almost always show up together. And when they do, they create a perfect storm for high blood pressure. So this would be insulin resistance and visceral fat and chronic inflammation. And I group these together because you can't really talk about one without running into the other 2. They feed into each other, and together they cause high blood pressure from multiple different directions at the same time. So let's start with insulin, because this is one of the most underappreciated blood pressure hormones there is. When insulin levels are chronically elevated, which happens with insulin resistance or prediabetes or diabetes, your kidneys start holding on to sodium. And when the kidneys retain sodium, they also retain water, and that increases your overall blood volume, which then causes high blood pressure. And this can happen even if your salt intake hasn't changed at all. In this situation, the sodium itself isn't the main problem. The problem is the signal telling the kidneys to keep it. And the signal is insulin. This explains a pattern I see all the time. Someone develops early insulin resistance or prediabetes, and right about the same time, their blood pressure starts creeping up too. They look like separate problems, but they're often coming from the same driver, which is chronically elevated insulin. And that's why the low salt advice only gets you so far. If insulin levels stay elevated, your kidneys keep holding on to the sodium regardless of how little sodium you actually eat. You can cut sodium significantly and still see retention because the signal driving it really hasn't changed. And this is where visceral fat enters the picture. So visceral fat is that fat stored deep around your abdominal organs. Is different from the fat that you can pinch under the skin, which is the subcutaneous fat. And it's not just passive energy storage that you get from visceral fat. Visceral fat behaves more like an endocrine organ, meaning it sends hormonal signals all throughout the body. It releases pro-inflammatory molecules, and it activates the renin-angiotensin-aldosterone system, the same hormonal pathway we talked about earlier. And on top of that, it increases your baseline sympathetic nervous system activity, which is your fight or flight system. And when that system stays chronically elevated, your blood pressure slowly goes up. And here's the tricky part. Visceral fat doesn't always show up in obvious weight gain. Someone can have normal body weight and still carry significant amounts of visceral fat. And this is where it's helpful to check your waist to height ratio or get a body composition DEXA scan, which is an easy and relatively cheap way to assess for this, at least in the US. Now, sitting in the middle of this whole process is inflammation. So visceral fat releases cytokines, which are signaling molecules that activate inflammation throughout the body. And that inflammation directly damages the endothelium, that thin layer of cells that line the inside of your blood vessels. And when the endothelium is inflamed, it produces less nitric oxide. And nitric oxide is that signal that tells blood vessels to relax and widen. So when nitric oxide levels drop, your vessels become stiffer, and I think you're starting to see the pattern now. Stiff vessels push blood pressure higher. So if you zoom out, the full picture looks like this. First, high insulin levels tell your kidneys to retain sodium, and they also promote visceral fat accumulation and the overall inflammation. And visceral fat then adds more inflammatory signals and activates more hormonal system that also raise high blood pressure. So this becomes just an endless and self-reinforcing cycle. So how I approach this with my patients: if somebody comes in with high blood pressure, one of the things that I absolutely want to see is their fasting insulin levels. And we need to check it to assess for early stages of insulin resistance. And this is important because fasting insulin levels can be elevated for years before your routine labs like hemoglobin A1C or fasting glucose start looking abnormal. High insulin levels are basically a sign that your pancreas, which is the organ that produces insulin, is working overtime to keep your blood sugar under control. Your body is pushing out more and more insulin just to keep glucose levels in the normal range. But the good news is, the earlier you catch insulin resistance or high insulin levels, the easier it is to reverse it. And it usually doesn't require anything extreme. The biggest lever you can pull is removing all the signals that keep your insulin levels high all day long. So the first step is cutting back on ultra-processed foods and refined carbohydrates. So this would be things like sugary drinks or fruit juices, pastries, and packaged snacks like chips. These foods, they digest very quickly and they cause repeated glucose and insulin spikes throughout the day. And they're also very energy dense, meaning they give you a lot of calories without creating much fullness, which then makes it very easy to overeat. Instead, try to center most of your meals around whole foods that slow digestion and they keep your blood sugar and insulin levels steady throughout the day. Build your meals around things like eggs and fish, lean meats, and minimally processed carbohydrates that contain a lot of fiber. So these would be things like potatoes or sweet potatoes, or legumes or beans. And I like to frame this as an 80% rule. If about 80% of your meals come from whole foods and minimally processed foods, there's still a room for flexibility with the other 20%. That flexibility makes the changes sustainable long term because most people, myself included, cannot completely eliminate those delicious but problematic foods forever. And we talk about it quite a bit, but exercise plays a huge role in all of this. So first, resistance training is especially powerful because it increases your muscle mass. And muscles act like a glucose sink. The more muscle you have, the more glucose your body can pull out of the bloodstream without needing large amounts of insulin. Even 2 short resistance training sessions per week can significantly improve your insulin sensitivity over time. And then aerobic activity will help you in a completely different way. So this will help you improve your mitochondrial function, and it will amplify your ability to burn your fat for fuel, which will help you with insulin resistance and at the same time reduce your visceral fat. Now, the next hidden cause is very important to recognize because it's one of the most under-recognized drivers of high blood pressure, and that is obstructive sleep apnea. And the reason it matters so much is because studies estimate that somewhere between 30 to 50% of people with high blood pressure also have sleep apnea. So what's actually happening here? Well, obstructive sleep apnea means the airway repeatedly collapses during sleep, usually in the back of the throat. And the muscles that normally keep the airway open, they just relax too much, and your airway narrows and breathing temporarily stops. And this can happen dozens, sometimes even hundreds of times per night. Now, every time breathing stops, oxygen levels in the blood start to fall. The brain senses that drop almost immediately and activates your sympathetic nervous system. So that's your fight or flight response. And heart rate jumps, and your stress hormones surge, and your blood vessels tighten. And as a result, blood pressure spikes. And then breathing goes back to normal, and then the cycle repeats itself. So instead of your nervous system calming down at night, which is what healthy sleep's supposed to do, your body is getting hit with these repeated stress responses all night long. And over time, those constant surges in your fight or flight system begin to push your baseline blood pressure higher during the day as well. And there's another layer to this. Sleep apnea damages that super important inner lining of your blood vessels that we keep talking about, the endothelial lining of the arteries. And as we talked before, that disrupts the production of nitric oxide, which, because of that, your blood vessels get stiffer, and that raises your blood pressure. So now you have at least 2 mechanisms pushing your blood pressure high at the same time. And the tricky part is that a lot of people with sleep apnea don't even realize they have it, because these awakenings are often only a few seconds long, so people don't remember them. And instead, the clues show up in other ways. So you see things like loud snoring, or morning headaches, or feeling tired even after a full night of sleep. And another misconception is that sleep apnea only affects people who have obesity or excess weight. Weight can definitely increase the risk, but it's far from the only cause. It could be caused by airway anatomy, or your jaw structure, or nasal obstruction, or enlarged tonsils. And genetics can all contribute, even in people at a normal body weight. So if someone has persistent high blood pressure, especially when all the other factors that we talked about look to be well controlled, well, we definitely have to rule out sleep apnea as the cause. All right, I hope this was helpful. Stay healthy, and I'll see you in the next one.